Thank you all for joining us this afternoon to have a discussion about the 2021 Call for Science for the American Academy of Otolaryngology Head and Neck Surgery Foundation annual meeting and Oto experience. This is a big one. This is our 125th reunion meeting. Thank you all for joining us. I'd like to especially thank and acknowledge my two co-presenters today, two of the leaders from the annual meeting program committee, Dr. Jelena Ankassawan. Dr. Ankassawan is the leader of our pediatric otolaryngology subgroup and previously has been the leader of our laryngology subgroup. And Dr. Rod Rezai, who's in his second year leading our head and neck surgery subgroup. Is that right, Rod? Yeah, second year. So thank you both for being with us. Our goals today are to review the Call for Science, to review some of the different presentation types, to provide you some helpful tips, and to answer any questions you have about the Call for Science for the annual meeting. The recording will be uploaded to our website, and so please definitely get your questions out there today. We would love to help address them. Feel free to toss questions in the chat box. At the end, we will open up to questions as well. To get this out of the way at the outset, we are planning for a live meeting in LA in October. With the vaccines coming, we are very hopeful that we're going to be together in LA in October. But if we have to pivot to a virtual meeting, we'll be prepared to do so. And so as you're thinking about your submissions, think about LA in October together for what may be one of the first live medical meetings in the pandemic era. So to review the different presentation types a little bit, there are a lot of opportunities to present either your science or to give educational sessions at the annual meeting. And I would suggest that it all starts with a question. And no matter what age you are at in your training or in your practice, whether you're a relatively new practitioner or a more experienced practitioner, it all starts with questions. Any of our science starts with a good question of asking, how could I do this better? How are we doing this? What could we do? And actually, any of our good educational presentations start with questions as well. How could I pass on the way that I'm doing things? What do I do that's different from my peers? What am I doing that is a best practice? And so if you have a question about our field, that's the launching point for any of our educational opportunities or presentation opportunities at the annual meeting. We have two different formats for science. You can submit for an oral presentation, which is a typical podium presentation with a Q&A session. Or you could submit for a poster presentation. Poster presentations in the past have involved a live poster, a physical poster. This year at this meeting, we will most likely be doing virtual posters. However, the virtual posters will also come with an opportunity to give a short recorded discussion of your poster as well that will be posted online with the poster. So there is still an opportunity for a sort of oral presentation with posters this year. A lot of people will choose the oral will accept poster option. And I have to say, oral presentations are fairly competitive at this meeting because we get a lot of submissions, but we do have more opportunities for poster presentation as well. So if you have any kind of science that you're ready to share with your colleagues, this is a wonderful setting to do it in. The oral presentations are committed to be submitted to the journal of our academy, the Journal of Otolaryngology Head and Neck Surgery, whereas poster presentations are not committed to the journal, although it is suggested that poster presentations still be submitted to the white journal for subsequent publication. On the other hand, we have multiple different educational formats. The two most common that you're most familiar with are the expert lectures and the panel presentations. Now, the expert lectures were previously referred to as the instruction courses, and the panel presentations were referred to as the mini seminars. That verbiage changed a few years ago for those of you who are familiar with academy meetings of days past. The expert lectures involve 1 to 2 speakers who should be speaking on a topic that they are experts on, that they have demonstrable experience in, that they have published on, that they have lectured on in the past, that they are recognized as experts on. So the expert lectures were traditionally didactic lectures, although A lot of the really great expert lectures of the past few years have also involved audience interaction, Q&A with the audience. Some have even involved elements of simulation or hands-on things. But in general, the expert lectures should be driven by expertise. So when you recognize your expertise, you can transform that into an expert lecture with one of your colleagues. And we do really like to see experience in presentation or publication on the topic demonstrated in the submission for an expert lecture. On the other hand, panel presentations tend to be driven more by debate, by question, than by expertise. Meaning a panel presentation could be put together by someone with a great question who then goes out and gets people who have relative expertise in the area to debate the best practice. So what is the best approach to the central neck now in thyroid cancer? What is the best approach to mild snoring in sleep apnea and in children who don't have demonstrable OSA? Things that are still very much up for debate. Panel presentations, I think, hit home best when it becomes a group discussion amongst the panelists. Although I have seen some successful ones in the past years that were a series of presentations followed by a discussion amongst the panelists. But the bottom line is a panel presentation should be a hot topic, a debatable topic that is addressed by people with relative expertise in the area, understanding that no one has complete expertise in these debatable areas. There's room for debate. That's the point. So the moderator on a panel presentation could very well be someone who doesn't have expertise, but who's great at asking questions and facilitating a panel. It's a wonderful opportunity for our younger presenters or for new presenters to get involved presenting at the Academy by asking a great question and then finding the experts to debate it and taking them through the debate as a moderator. You're allowed to have 2 or 3 extra panelists besides the moderator in a panel presentation. A format that we rolled out last year were simulation sessions. Simulation sessions are meant to involve a simulation activity as the core of the session. So whether it's teaching the attendees a new skill with a simulator, either in a small format or in a large group format where the audience is watching the simulation. Either way would lend itself to a simulation presentation. Last year, our simulation offerings were a bit undercut by the virtual format. However, some of them still happened. And we would like to ask our submitters this year, if you have a simulation idea and can think of a way that you could still make it successful in a virtual format, should we be forced into a virtual meeting in October, that would definitely weigh well with the committee and would make your proposal viewed very highly. Under the simulation submissions, you can either submit for a small group format where each of the attendees is meant to actually use the simulator, or for a large group format where each of the attendees is meant to watch someone going through the simulation and learn in that way. Finally, there are the Masters of Surgeries videos. These are videos of short duration that demonstrate a surgical technique specific to the submitter, or of which the submitter has a special way of doing. The Masters of Surgeries videos are generally very well viewed during the annual meeting and will be available in either a live or a virtual format this next year. So we definitely welcome those. So these are the key formats that you can submit for this year. Now, in case we have any international attendees tuning into this webcast, you can also submit to the International Symposium. The International Symposium involves all of the different presentation types, but is set aside in a separate track and is judged with the other offerings, but ranked separately in the international track. And so if you are an international presenter, or if you are a moderator gathering a group of international presenters, you could also submit under the International Symposium. We have a couple of highlights of the Call for Science this year that are a little bit new from the past. The first is a new educational tract. We have launched a professional and personal development track for this year to focus us on some of the wonderful offerings we've had in the past and to expand on these offerings in areas like communication, leadership skills, mentoring and well-being or wellness, as well as issues of cultural competency and talks that advance diversity, equity, and inclusion issues in medicine, whether it's an introspective look at our otolaryngology workforce or our interactions with our colleagues, or whether it's something that might help us in our patient care to increase the way we employ cultural competency in our patient care. any talks of this nature would be welcome to be submitted under the professional and personal development track for this year. Another new option is to select a 30, 60-minute, or either duration for your talk. Some of the talks that are selected, which approved 30 minutes, will be paired up with scientific offerings so that we have some sort of an expert lecture or panel presentation for 30 minutes, followed by 30 minutes of relevant scientific presentations to put together a nice hour where we try to connect the science in the clinical practice. And again, I want to emphasize that we really need flexibility this year. If you can demonstrate that your talk or your proposal will be successful in a live or in a virtual format, it will definitely weigh with the committee this year, as we still have to face some uncertainty in what we're going into in the summer. So who's going to be scoring your proposals? Who actually looks at this, and how does that happen? Well, the annual meeting program committee consists of just over 50 members, experts from every different subspecialty of otolaryngology, comprehensive otolaryngology, the business of medicine. We have a number of members of private practices, employed practices, as well as academic practices on the committee. I'm sure as you glance through this list, you'll recognize some names of members of our academy. But these members all spend about a month at the end of February, at the end of January into February, reviewing many of the different proposals. Once the proposals are reviewed, they're then scored and reviewed by the annual meeting program committee subgroups. So you can think about the annual meeting program committee as a group of subgroups organized around the meeting. Each of the subgroups is scoring and selecting an educational track for the meeting. And so if you want to spend all of your time on head and neck surgery offerings, you can go to the head and neck surgery track throughout the meeting. If you submit a proposal that's a head and neck surgery proposal, it's going to be graded by the head and neck surgery subgroup. Most of our committee members will grade for at least 2 different subgroups, but have a primary subgroup where their main expertise is, and that's the subgroup that they help select the offerings for the meeting. So these are our subgroup leaders for this year in each of our academic tracks. So sometimes I'll get asked, which subgroup should I submit my talk for? Well, it depends. It depends on how you want to structure your talk. You could very easily conceptualize an otology talk that could be bent towards subspecialists, neurotologists, to a deep level of the subject that really a tertiary neurologist is going to be interested in. On the other hand, you could conceptualize the same topic to be presented to our comprehensive otolaryngology colleagues in things that they commonly see in their offices. One of my colleagues and I, Jeff Rastetter, he and I have given talks on subspecialty pediatric head and neck surgery in the past, but then we've also given talks on basic approach to common pediatric head and neck masses that all of us see in the office. And so we've submitted them under different areas depending on the focus of the talk. So you are not forced to submit in any specific area. You can choose the area that you think is most relevant to your talk. So that is the basics on the submission options for this year. I'd like to pause for a second, and I'm going to reach out to my colleagues, to Dr. Razai and Dr. Ankassawan, to ask them if they would share some basic tips with us. Dr. Razai, I see you on my screen here, so let me start with you. Can you please give our listeners some tips on what you think the things are that separate a really great proposal from the pack?
So I think, thank you, Danny, for that great overview of the submissions and what we look for. And specific, I can speak for head and neck, but I'll try to speak in general, as I've been on some of the conference calls, and I think some of these theories are shared by the various subgroups. And when I look at abstracts, and we also then look at the submissions for the panel presentations and such, speaking to the abstracts, we look at, is the topic relevant? And I think that can apply either to an abstract or even to the panel presentation. So is it something that's going to have what I'll say is limited applicability? So for instance, just to the head and neck surgeon, like you mentioned, or is it going to have more of a broader application to the general membership, right? And so we kind of look and see where the topic will fall. Is it relevant? Is it something that's current? Is it an identified need? So we talk about a gap analysis, and we look and say, well, where are those identified needs that the membership have brought to our attention, and is it going to address one of those needs? Is it going to be, the sixth talk on, a certain subject, or is it going to be one of a limited group of people that are trying to identify, that particular subject? When we're looking at the abstracts, is it a case report and a review, or is it an institutional experience? So how relevant is it going to be? Is it going to add to the body of literature? Is it going to add to our practice patterns? Is someone going to leave with a change in their practice pattern by listening to that panel presentation or by reading that abstract? When we look at references, so are they applicable? Are they just in the last 5 years, or have they actually looked at the body of literature to see, are they adding to something? Is it just ENT specific, or have they called upon multidisciplinary references to make sure that this is something that could be shared across disciplines? One of the things that really, I won't say that is of concern, as we look for clarity. I think you mentioned in one of your slides, is it presented in a way that's clear and concise? Are there typographical errors, or something that just doesn't make sense? So I'd advocate for people to have somebody besides yourself just read it over, even for some simple, grammar changes or something that you may think is pretty obvious, because remember, you're in it and you understand it and you know what you want to say, but someone else who's not part of the preparation may not come away, reading it the same way. So just for clarity is making sure your point is getting across. And then one thing that I've seen through the years is sometimes the conclusions don't match with what's being presented in the body of the either in the submission or in the body of the abstract. So for instance, if you have a list of 60 people, but you combed your experience over a 15-year period, that really doesn't fit. So only 60 experiences over 15 years, you can't then consider that an expert presentation. So your conclusion has to be taken with a grain of salt, that may not be necessarily a practice changing conclusion. It might be your experience or your recommendation, but not necessarily something that can have very broad applicability. So, these are just some things through the years that we look at. As far as the panels, and I think you covered this, we look for the mix of presenters, and perhaps everyone's definition of an expert may be different. And we are looking for inclusion. We're looking for diversity, not just on age, but also where are people in their practices? Are they in their mid career, late career, early career? We look at age, we look at gender, we look at a variety of things. And so I think you have to be, I won't say strategic, but I think you have to be cognizant of those factors, so not everyone needs to be an expert, but I've seen some panel submissions last year where they're discussing an expert presentation, but everyone in the group, including the presenter, was perhaps in the first 5 years of practice. So I don't know that can be portrayed, for instance, as an expert. That may be saying, hey, then the title of that should be stratified to say, something applicable to the first 5 years of practice, or how to establish something in the first 5 years of practice. So therefore, that person actually probably is going to be more of an expert on telling what are the strains and stresses of starting a 5-year practice versus someone who's been in the practice for 20 years. So I think that you have to tailor it and make sure you're being logical with what's being said. So those are just some thoughts that I jotted down.
Thank you. Thanks very much. If you go to the Call for Science webpage, this is the page you're going to land on. And I would encourage everyone to click on the 2021 Call for Science guidelines. A lot of times we go to the submission website after we've already written our presentation, but actually there's a lot of great information on the website to help start you thinking about your presentations and to help with your writing as you're in the process of putting them together. If you go to the guidelines, you'll see that in each of these different areas, there is a number of different facts about the process. And so there are some helpful submission tips to look at, key dates. All of this has a lot of great advice and was put together by some of our Academy staff. And it's a really great set of information for you. I would definitely encourage you, once you've decided on a specific format for your submission, go to the submission types and components, look through the instructions there. There's a lot of really useful information to help you put together your presentation on this site. So to summarize some of the really great suggestions from Dr. Rizai, I would just also reemphasize to make sure that your conclusion is justified in the science. Embellishment of data doesn't look good in an abstract, and I think that's one of the most common pitfalls I see. The other common pitfall is we want to see results, not the promise of results. And so we want to see your actual data in your submission. If you have an important study that is in the process right now, and it's going to be a game changer in some way in your field, we will have a late breaking abstract call in the summer for some science that's still coming together just before the meeting. I will say the competition for the late breaking abstracts is quite high, and they tend to be highly publishable, really advanced studies, the ones that get accepted as late breaking abstracts. It's very, very competitive. Dr. Zai, I put this up here on references. Can you discuss, when you're looking at a proposal, an educational proposal, how do you consider the references that people put in, that submitters put in? How does that factor into your judging the panels? And what kind of references do you like to see?
Thank you for that question. You know, it depends. So if it's a panel, and I think this goes to and supports what you mentioned earlier, you know, if it's a panel of proposed experts, then to substantiate why they would be considered an expert, you would see then perhaps some references that they have actually put out themselves that would substantiate them being able to speak on that. Does that make sense? Like, you know, if you're going to purport your panel as being like the leading cutting edge discussant on, for instance, let's say nerve monitoring, then perhaps that would be within your wheelhouse of publication, at least to substantiate why that group would fit that bill as being the expert.
I agree. Every year I'll submitted with sort of random references that are not their own references, but that are things you would cite if you were writing a textbook chapter. Definitely this area, it needs to be your references, representative of your work. And that could include presentation at grand rounds, invited lectures, other meetings. It's not only restricted to publication. I think I saw Dr. Ankassawan was back with us. Dr. Ankassawan, could I ask you to unmute and to share with the group, what do you think are some of the major pitfalls you've seen in submissions in the past few years?
So when you asked me to do this panel, I was reflecting on what I learned from being on the committee, because it was a giant eye opener to me. And I realized that there aren't a ton of time slots. So I think one of the first things to do is we are looking for a broad range of topics. We want to make sure every topic within the subspecialty is covered. So for example, to laryngology, the thing I did most recently, you know, we don't need tons of submissions, unfortunately, panels and lectures on vocal fold paralysis or injection augmentation, for example. So I do think, I do think that, so what I remember doing was scanning all of the presentations from the past couple of years and trying to see where the gaps were and trying to see where a topic gap might be. And then choose that as your topic, just keeping in mind that we're trying to make it broad. And you had mentioned this before, but give me an idea who the audience is. So for laryngology, you know, not the majority of the Academy membership does not necessarily need to know about the nitty gritty of high level subspecialty laryngology. So trying to make it applicable to the Academy membership as much as possible. So I think those are definitely topics that are pointers when you're trying to plan your panel or your lecture. And also I think a catchy title totally helps. If it's like the same title as every other paper, people just doesn't catch people's attention. So those would be some of the things that I would think about. Just like, you know, if there are already 3 topics that are presented frequently, you don't need to have a 4th or 5th on the same topic. So.
I agree. Thank you. And actually, to that point, here is a list of gap topics that were identified by our educational committees as needing more representation at the annual meeting. These are available on the submission website. I'm going to actually ask to try to get them moved onto that same FAQ page that I showed earlier in the meeting. At present, they're available if you actually go into the submission and click on any of the tracks. You can pull up a list of the gaps or screenshot them with your iPhone right now off the screen. But these are some of the gap areas that we definitely welcome submissions on for this meeting. And I'm going to advance to a second page here. I'll wait for, I see some iPhones up out there. So I'm going to move on to the second page here. Here's the rest of our gap analysis. So I'm going to make sure that this gets moved to the FAQ page on the submission site, but it is currently available in the submission itself if you go in and look. And these are all topics where we need more submissions, both expert panels, expert presentations, panel presentations, and science. So Dr. Ancasawan, I'm going to come back to you for a second here. Favorite thing to see in what's the number one thing you would say that makes a presentation, a proposal for you in terms of science, in terms of the scientific submissions? What's the thing that you most look for?
Okay, in the scientific submissions. So I'm a clinician, so I confess I get really much more jazzed about big clinical studies than necessarily basic science. Now that's my personal bias, but a really well-designed prospective study. I mean, in our world, those are so rare. They're like little unicorns. That is the most exciting thing to see with something that's really going to change my clinical practice. Now, again, coming from the perspective of a clinician. So, yeah.
Perfect. Perfect. Well, if you have questions about the submission process after today, or if you're watching this recorded, feel free to email your question to programs@entnet.org. The closer we get to the deadline, the longer it may take to get a response. There were times last year, especially when we committed to or switched to virtual, that our academy staff were fielding literally thousands of questions every day or two from this email address. So, you know, the closer we get to the deadline, the longer it'll take to get a response back. But this is an area where you can submit a question that goes directly to our academy staff, and they'll get it on to me or any of our subgroup leaders if there's a question about the submission process. You can also find all of us on ENT Connect. If you're not on ENT Connect, it's like your personal address book to every ENT in the academy. You can search out and send emails to any of your colleagues in the academy through ENT Connect. Dr. Rezai, I'm going to ask, I know you've been perusing the chat box. Do we have any questions that we should take a look at there?
Yeah, and Tammy addressed a few of these with responses to everyone, but if people don't have access to the chat box, you know, the first question was, does the 30 or 60-minute format apply to the professional development track? And the answer was that yes, the 30 and 60-minute format will apply to all specialty areas. So it's not just limited to one or more. It's all of them. The other question that I'm going to ask you, Danny, was from Dr. Maury. Said, how are society-sponsored panels evaluated, and where can we find those lists?
That's a great question. So there is a spot in the submission process to indicate who is supporting your submission. You know, is it one that is not supported by anyone in particular, or is it supported by an academy committee, or is it supported by a sister society? And when you indicate that, you'll need to indicate an email address and authorizing leader from that committee or from that supporting society who authorized the support. Those are looked at in different ways by the committee. In general, that does give some weight to the submission, and I believe most people on the committee do tend to favor submissions that are supported by committees or other societies. Every year, 3 of our sister subspecialty societies have a reserved presentation spot at the meeting, and those invitations are carried out by the president of the academy directly to the presidents of those sister societies. So if you're one of those 3 sister societies this year, Dr. Bradford will be in touch with, or probably has already been in touch with your society's president. And those rotate every year. But in general, if you're from another society and you'd like to get something on to the meeting, you can indicate that it's supported by the society, who the contact is, and always feel free to have any of your leadership reach out to me if there's a specific concern or a specific strategic need for any particular bit of programming.
So the
That's what I would
next,
say to that.
yeah, thank you. The next question, and I think this is also one that's evolving and may become more clear the closer we get to the meeting, but it has to do with if the meeting is virtual, how will the panel presentations be held? Will they be pre-recorded or live? And I know this is something that we're still discussing.
Yeah, that's a really great question. And it will, if we go to a virtual only format, we will most likely do what we did last year and have a mix of pre-recorded and of live panels. You know, we learned a lot from last year. It was a feat to get it done as quickly as our staff did. We basically only had 3 months of preparation time. I think the feedback we've gotten was overwhelmingly positive about the educational quality of the meeting. We had a huge number of viewers, 30,000 plus hours of viewership during the meeting. What we missed on was the social aspect of it, the interactive aspect of it. We had that to some degree in the office hours offerings, which were really popular and which will be repeated again this year in some format. We had it to some degree in the live Q&As, but we know that the vast majority of our educational content did not have a live Q&A aspect to it. So as we're working on formats, platforms for a virtual meeting for next year, if necessary, we'll be considering the balance between the live content and the pre-recorded content, with it in mind that we have to have more interaction. I mean, that's what makes it a meeting, not a lecture, right? Interestingly, the pre-recorded sessions last year, by the data, were actually viewed considerably more than the live sessions, even considering that the live sessions were recorded and offered later on demand. And so I really think it's supported for us that there is a desire for all of this content, whether pre-recorded or live. And we are definitely, even if we are live next year, we are definitely going to have a virtual component to the meeting and a recorded aspect to the meeting to be available on demand after the fact. I think we can't go back from that. That's going to become a standard part of, I would suggest, medical meetings in general, but certainly our meeting.
As a follow-up to some of the discussion earlier, this can perhaps Julina or Danny, for any of us, you know, we all have alluded to, you know, as far as choosing topics to make them relevant, but also to be cognizant of other submissions either in the past or current. And the question is there a list of the previous titles that had been mentioned? So is there a place where that's listed, or where someone can get an idea, perhaps the flavor of submissions in the past or the current titles that we're looking for?
I mean, I confess, when it was a handbook, I used to just look through the handbook. You can also just go to the website and look under your specific subspecialty. I will say though, I would encourage people, even if you don't get accepted one year, don't give up. Like, keep trying, because it may not just be a good fit for that particular year, but depending on the types of submissions that a particular year gets, it might get in another year. So I always feel bad when people get discouraged. Like, I tried to submit and they didn't get it one year. We try to give some feedback now. We've instituted a system, try to give some feedback to try to make it, to give you tips on how it might be better. But I would invite people to keep trying.
And to expand on that, Tammy, for those that can't see the chat box, and something that I've also used when updating CV to look for the exact presentation titles of either abstracts or panels and such, is the app has a 3-year archive of the educational program. And so you can still download the previous apps for 3 years, and that will be a way to look at what had previously been submitted or accepted. And you can go find that in the Google or the App Store per Tammy.
Absolutely. Any other questions in the chat box, Dr. Rizai, that we need to take a look at?
I think we've covered it that I've seen. I've been between Tammy answering and I think what we brought to the general discussion.
Excellent. For the group of participants who are here live, if anyone would like to unmute and ask a question, we'd be happy to entertain any. Well, I think that represents about the average length of time to find the mute button, so I'm assuming we're good. I would just like to thank everyone for taking time if you've been listening this long, and especially our participants who came today and anyone viewing it after the fact. You know, I wrote this for an article recently for the Bulletin, but the very first meeting in Kansas City in 1896 was about 50, we're not sure of the exact number, but about 50 physicians who came together from all over the country to basically form the body of the academy. And they were invited by Dr. Hal Foster. He sent handwritten letters, and they all came, and each one of them brought a paper to share. And some of the papers were observations of one patient, but they were new observations of things that hadn't been discussed before. The very first paper ever presented was an ophthalmologist presenting a case of sigmoid sinus thrombosis, 2 cases actually. One of patients died and one patient lived. The discussion of that paper was opened up by an allergist from New Orleans, and then there was a robust discussion about it. And I guess the point is, just as much as it was true 125 years ago, that the academy is not a nebulous term, a nebulous topic. It is literally the body of physicians and care providers who come together at a place and time to all teach each other and learn from each other. And just as it was critical for everyone to step forward for the meeting then, it's just as critical now. We need your voice. We need your engagement. We are the academy. There is no academy other than all of us together. And so I'm really grateful for your interest. We hope to see your proposals in the call for science, and more so, hope to see you in LA in October. Thanks for tuning in.